throat and lung cancers, prevention and management through exercise expectorant therapies. By Manikonda Prakash Rao, Hyderabad. Excellent Healthcare awarded at Indo Global Healthcare Summit and Expo 2014. Introduction. The objective of the paper is to create awareness among people about alternative and complementary methods to protect themselves from respiratory diseases like asthma, bronchitis, chronic obstructive pulmonary disease, lung cancer, etc. The diseases cause the following changes in airways. Inflammation is a physiological process and plays the role of immunological defense against infection, injury, or allergy. As a result, inflammatory cell recruitment commences. Hypersecretion of mucus is the result of goblet cell hyperplasia in respiratory mucosa and is a prominent feature of inflammation. It is a major pathological feature of airway diseases. Chronic mucus hypersecretion is a potential risk factor for an accelerated loss of lung function. It is a common feature in elderly. The thick viscous mucus in the lungs will be conducive to pathogens. Chronic inflammation and mucus hypersecretion may significantly contribute to transformation of normal cells into cancer cells. Bronchospasm. The three factors together cause breathlessness. It is an additional factor in asthma patients. Insights. According to Dr. Sarah Herrick, a research fellow, Dr. Robin Gore, a consultant in respiratory medicine and research fellow, and Dr. David Thornton, a senior lecturer in the Faculty of Life Sciences at Manchester University, who were conducting research 2008 and 11 as a team into the factor of hypersecretion mucus. An abnormal production of mucus in the airways is a major contributor to the pathology of asthma as well as other debilitating respiratory conditions such as cystic fibrosis and chronic pulmonary obstructive disease. Insights continued. They opined that no mucus directed therapies are available for asthmatics, and the factors that lead to excessive mucus secretion during both chronic and severe asthma are not understood. Further, presently available drugs like mucolytics, mucokinetics, mucoregulators, steroids, etc. are not able to meet the needs of the sufferers. Further, chronic inflammation and its a prominent feature, hypersecretion of mucus or fuses that ignite many airway diseases including cancer. Without these two factors, there cannot be inflammatory cell recruitment to the site of infection, injury or allergy. Continued presence of inflammatory cells or carcinogens may lead to cycles of tissue injury, and repair, resulting in carcinogenesis of the airways, that is DNA damage. Therefore, treating these two factors is very important for airway integrity and to protect from airway diseases including throat and lung cancers. For resolution of the said factors, a rapid programmed clearance of excess mucus is necessary. As a result, the origin of it, inflammation, gets resolved. Depending upon the stage of the diseases, medicinal assistance becomes necessary. Since upper airway passages and bronchial airways constitute only one pathway, the exercises explained should be practiced from there itself. Methods. Exercises evolved are a potent medication in history. They are mucokinesis. They help in cleansing the adhesive mucus from mouth, nose, pharynx, the primary sites of colonization of pathogens, sinuses, the way stations to the brain and the bronchial airways. They reduce C-reactive protein, resulting in reduced inflammation. Exercises strengthen the remodeled airways and reset the biological aging process. Methods. Upper airway passages lung cleaning exercises. The exercises are based on the following concept. Living cells are osmotic system. They shrink in hypertonic solution and swell in hypotonic solution. Take a glass of hypertonic solution, keep it at the entrance of the nasal passages. Bend the body forward to about 70 to 80 degrees, slowly snort in the solvent. It goes in through the nostrils, up through the nasal passages, down in throat, pharynx, from where it takes a U-turn, enter the oral cavity and collects in the mouth. Spit it out. Blow out the nose forcefully. The excess mucus collected in upper airway passages gets drained out through mouth. Defunct cilia become active and ciliate mucus from lungs towards upper airway passages, mouth, and it can be pushed out easily. Any mucus left over can be cleaned through bronchial airways cleaning exercises. Physical, aerobic and yogic exercises. Upper airway passages cleaning exercises. These exercises should be practiced with hypertonic solution, that is, a solution having greater osmotic pressure than that of cells or body fluids and draws water out of cells, thus inducing plasmolysis. The solution should be warmer than that of body temperature, that is more than 37 degrees Celsius. Better results can be achieved with 40 to 41 degrees Celsius. Bronchial airways cleaning exercises. They are based on inspiratory and expiratory reserve volumes of the patients and forced expiratory techniques. They help in draining out total mucus from upper and lower airways. Physical, aerobic and yogic exercises. Strengthen inspiratory and expiratory muscles and make the airways flexible. Fact: any mucus related respiratory health problem commences from upper airway passages and spread to tracheobronchial tree as they constitute only one pathway. The mucociliary clearance mechanism becomes defunct and when excess and sticky mucus forms. Once they are cleaned, the defunct cilia become active and ciliate mucus from lungs towards nasal passages, mouth, and it can be pushed out easily. Result of the exercises. The bronchial airways cleaning exercises help in draining out total mucus from airways. The respiratory and other diseases originating from its pathway come under control. Conclusion. The exercises are based on the concept. Once the offending factor, excess mucus, is removed, the origin of it, inflammation, gets resolved. The scope for transformation of normal cells into cancer cells, that is, chances for DNA damage, gets reduced. Thank you for your time.